Capuchin TV, kitambulisho Katoliki.
All right, it is exactly 11 minutes past 3 p.m. Good afternoon and welcome to this discourse live from Capuchin Television Network. Now, we were supposed to bring you this earlier on as usual every Friday, but due to the proverbial unavoidable circumstances, we weren't able to bring this earlier on, but here we are, better late than ever. So my guest here tells me that there is a great significance attached to number three. So it is the time that Jesus Christ said it is all over. That's why even people wake up at 3 a.m. to pray, and they believe at that time, actually, your prayers really can be heard more than any other time of the day or the night. So before we proceed, or now allow me also to introduce my guest before even I get to tell you what we're going to discuss about today. Doctor, it's good to have you.
Thank you.
Please tell the viewer about yourself.
Okay. Good afternoon, everyone. My name is Dr. Stephen Thigu. I am a medical doctor at the Mater Hospital. I work at the wards and at the accidents and emergency department. Thank you.
Thank you very much for making time for this show. And my name is Sasha Elizabeth, and today we are delving deep into thyroid diseases. This is something that you haven't touched a lot. Actually, I think we have not explored this area of the thyroid diseases for quite a long time, and I think it is ideal to bring you this today. So you can also keep your questions coming regarding the same on, as usual, on our social media platforms, and you can also send an SMS or call 0717-424-866. You can also charge the SMS, that is 21760. You can also send an SMS there as one way of supporting this Catholic broadcasting ministry. So we get started, right?
Yes.
Let's talk health.
Yeah,
Before,
sure.
Later on, we might get time to understand this great significance about number three.
Sure.
So now, the thyroid glands, could you please try and explain to us what a thyroid gland is?
Okay, thank you. The thyroid gland is part of a body system called the endocrine system. Basically, what that means is that it doesn't work alone, but it works with other glands in the body to control different activities within our bodies. Most times, those are activities that we have no control over. So it is a small butterfly-shaped organ that is found just below the Adam's apple. Most times for normal people, you will not see it. You will not identify it grossly, that there is the thyroid. But whenever there is disease, then you can see it. It weighs about 10 to 20 grams. So you can imagine that size. It's quite small.
Oh,
yes.
That's small indeed.
Yes.
Okay, so now what do thyroid hormones do in the body?
So the thyroid gland releases chemicals. Let's call the hormones just chemicals. And the work of these small chemicals, what they do, the hormones, they regulate different activities within our bodies. And I'll give you an example. The thyroid hormone, we say that it regulates basometabolic rate. What that means is that it tells your body, now it's time to burn carbohydrates. Now it's time to generate energy. This is the amount of energy you need to generate. Now it's time to concentrate and be alert. It also controls a bit of reproduction.
So it also controls concentration?
Yes, yes,
So
yes.
if you are distracted, that means your thyroid gland is not functioning normally?
It
Or
is
there's
likely.
a disruption in the process?
It is likely. You know, the body is multifaceted. It does many things, but it's likely that the reason you see someone having difficulties concentrating, you see someone having a depressed mood most times of the day persistently, it is likely that the thyroid gland is playing a small part to that. In the same breath, if you are releasing too much of this chemical, it is likely that when you see someone feeling their heart is pounding, they are full of energy, they are constantly eating and not gaining weight, they are overly sweating, you have diarrhea which you can't explain, it is likely that you have excess of this thyroid hormone.
Thank you very much, Dr. Thigu. Now, this thyroid gland, sometimes when it gets infected, we have different diseases that can affect it and make it to swell. And the different conditions really can be confusing, especially when you just realize that the thyroid gland is swelling and you can't really tell what the problem is. Could you please share with us the most common thyroid diseases?
Yeah, thank you for that. As I said earlier, the thyroid gland releases thyroid hormones, okay? Those small chemicals that control the activities, different activities in the body. So you can either release too much of that or too little of that hormone. So if you are releasing too much due to a disease process, we say then that you are having hyperthyroidism. You are having excess of this hormone. If you are releasing too little of this hormone, we say that you are having hypothyroidism, or too little of that hormone. So as I mentioned a bit earlier, when it comes to hyperthyroidism, too much of the hormone, you can imagine some of the things that you'll feel. You may feel like your heart is popping out, call that palpitations. You may be eating, but you're not gaining weight. You're sweating too much, you're having diarrhea. These are signs that someone cannot sit back at home with. So most times, people who have excess of this hormone or hyperthyroidism, they'll go to hospital and they'll be checked. But on the other hand, people who have too little of this chemical or the hormone called thyroxine, or that thyroid hormone, perhaps you only have some dull moods sometimes in the day. You have disturbed sleep, and some people, they may complain of infertility or difficulties conceiving, or constipation, things that you can't explain. So you find that there are almost symptoms that are tolerable, that can be explained by other illnesses, like people will say, you're looking depressed, you're looking sad. So rarely, or when we have just small reductions in the hormone or hypothyroidism, some of those people usually don't go to health facilities to seek care. And that's why we are here today, so that we can discuss this, because it's a treatable condition.
Wow. Thank you for that, Doctor. Now, what are some of the causes of these thyroid diseases?
Okay, thank you. So what happens in both excesses, that is the hyper and the hypo, the most common cause, let me just divide it first and discuss the hypo, the little or the too little of the thyroid hormone. In our setting, if you went to a shop and bought salt, you'll find something written iodized salt, or salt that has iodine added to it. So we have places in this country where that mineral called iodine is deficient, or it's not there in the foods and in the soil and in the waters. Mostly people who live in the highlands. So we've had thyroid diseases as a result of iodine deficiency or lack of iodine. Thank God that this was identified much earlier, and most times now we have iodized products like salt that we add to our food. The other causes of thyroid diseases, and these are the more common ones, I just chose that one because it tends to affect our side of the world. The other common causes is something we call autoimmune diseases. What that means is that you have an illness where your body recognizes the thyroid gland as an enemy and starts to destroy. So we call those autoimmune diseases. Those are the more common ones that we see. And they're the more common causes of both hypo and hyperthyroidism. So to give an example further is that these diseases then, they may run in families, okay? You may find that it's affecting people from certain families than others. You find that the prevalence also, or the number, when you look at men and women, it tends to affect more women than men. The ratio. So? It's a good question. So, being autoimmune diseases or diseases where there is destruction, it has been found that there is an aspect of among women, among females, that you have how the genes that affect the probability of having the disease tends to be carried more in women. So you may find, like in a family, it's more of the females who are affected. Not that it doesn't affect men. It does affect men, but tends to be more women than men. Yeah, so I've talked about autoimmune causes. I've first talked about the iodine deficiency, then autoimmune, or where the body is recognizing this as an enemy and destroying part of the thyroid gland. Then you may have common things like infections. Okay, so you can get a disease and the gland, like any other part, can get infected. Okay. So
in essence, women are more at risk of contracting or having autoimmune diseases than men?
That's a very good question, because the autoimmune disease, it's a spectrum, but generally you'll notice that autoimmune diseases tend to have a tendency towards female than male. Not that they don't affect men. They do affect men.
And there's no any rationale behind that?
So most of what has been studied...
Any medically proved rationale?
Thank you for that. So what has been studied now just shows more, because there's a genetic predisposition. You know, it's your genes. Genes are it's like what predetermines you to be a woman or what predetermines you to be a man, because it's a genetic predetermination. So you'll find that the same, some of the genes that are carried more in the women or are expressed strongly in the women tend to predispose them more to getting some of these autoimmune illnesses. So this is a very fluid field in medicine. It's still the field where we are discovering new and more things, and most of the diseases that initially were not explained are being explained, tend to fall in that broad category of autoimmune diseases.
Okay.
Yes.
So understanding the prevalence rate of a disease also helps people to look out after that, and also to be able to make important decisions in as far as medical health and wellness is concerned. So what is the prevalent rate, or how common is hypothyroidism in Kenya?
Yeah, thank you. Talked about hypo, it means too little of the chemical called thyroxine. And as I explained earlier, the symptoms can just be, silent, or in a way, people can easily explain them as other things. So you find that studies now are showing in places, we don't have conclusive studies in Kenya, but around Africa and in the West, the prevalence of hypothyroidism is all the way up to 1 in every 10 people. You can imagine if you counted 1, 2, 3, 4, 5, 6, 7, 8, 9, the 10th person may be walking around with hypothyroidism. So that is quite high, and so you can imagine in a country like ours, we have 50 million people. There might be a probability that you have 10% of that, 5 million people who have, in one way or the other, some deficiency of this thyroid hormone. Yes.
Thank you so much. And what is the probability of one getting hypothyroidism if, say, if one of their family members happened to have it?
Yeah, as I mentioned earlier, that there is a genetic risk or there is a familial risk to this disease. It means then that if you have a relative, and by a relative I don't mean a husband or wife, I mean a blood relative, a brother, a sister, a parent who you are related by blood, who has hypothyroidism, then it's important that if you are feeling sad, mostly you have a depressed mood, you struggle with constipation, you have weight gain that you can't explain, you're struggling with infertility, it's important as you go to the facility, to the hospital to be seen, to ask the doctor or to suggest to the doctor to have your thyroid hormone levels checked. Yes.
So does that mean that there is a possibility of if you are you contracted hypothyroidism, there is a probability of also transmitting it to your children?
So the way this disease runs, it's not like a linear or like I have it, so I've passed it on. Because I've said that there are many genes that play a part into that. There's an aspect of the environment that plays a part. As I mentioned, lack of iodine in the environment plays a part. So in terms of transmission, it's not like assuming now I am the one with hypothyroidism that I'll pass to all my children. No, it doesn't go like that. It only means that if I have hypothyroidism that is autoimmune in nature, there is a high probability that someone in my family line may have it. And not that they passed it to me, it just means that we are more at risk. Let me give an example with a familiar disease. For example, a disease like high blood pressure. You know, there is a risk of developing high blood pressure because of diet, lack of exercise, and other things. But you find that there may be people in some families who, you know, you eat healthy, you exercise regularly, but you still develop high blood pressure. You didn't develop it because it was passed to you linearly, but your genes put you at risk of getting that disease. The same applies to hypothyroidism. So you may find that some people within some families are at higher risk of having this disease.
There is this medical jargon, subclinical hypothyroidism. Could you please help us understand this concept?
Yeah, thank you.
What does it mean?
That's a good question.
And
When
how different is it from the normal hypothyroidism?
Okay. Thank you. So when you say subclinical, you're basically meaning that the level of the hormones are low, because you said hypo is low. That hormone is little in the body, but it's not little enough to cause very severe symptoms. So, you know, you may be dull sometimes of the day. You may be struggling with some constipation here and there. You may be struggling with disturbed sleep, for example. You may be struggling with fatigue and so forth. But it has not reached the threshold for you to say, let me go to hospital and get checked. And that's actually the reason why you're here, to raise awareness about this illness, because the subclinical form is just a variant in one continuum of the disease. The subclinical form tends to be very common in the population. Out of the 10% that I said earlier, it will be almost 90% of the people they'll have subclinical hypothyroidism. So let me give a practical example. You have this person, they have gotten married in this relationship. They are trying hard to conceive. You know, they have tried everything. They feel, you know, I'm eating healthy, I'm exercising, but my periods somehow are not regular. I'm struggling with infertility. Perhaps this person may be having some subclinical hypothyroidism, and part of the assessment for the infertility would involve checking for the thyroid hormones.
Thank you very much. My director says it's time to take a break, and when we come back, we'll be looking at the symptoms, the diagnosis, and treatment modalities that are available. So stay tuned.
Thank you.
Capuchin TV, kitambulisho Katoliki. Welcome to Matamis Recordia Hospital, Buru Buru Clinic for holistic medical services.
This is Buru Buru Medical Center, which is part of Mata Hospital. And at Buru Buru, we essentially offer services offered in Mata Hospital.
We are located in the first floor failing building above Quick Mart. In Buru Buru, we have general consultation Monday to Friday. Saturday and Sunday, they are still available. We still have specialists. On Tuesday and Thursday, we have gynecology clinics running. from 8 a.m. to 2 p.m. We have a pediatrician clinic running on Wednesday at 8 a.m. to 2 p.m. We normally have a wellness, which we normally do from Monday to Sunday. Every day, feel welcome, you can come.
Experience the difference in our wide range of quality, responsive and compassionate healthcare services.
We have very highly skilled and qualified staff running the units. We offer services including doctor's consultation services, which is the general doctor in the outpatient unit. We also have laboratory services and pharmacy services. On particular days of the week, we have specialized clinics, which include the physician clinic, where we have our hypertension and diabetes patients followed up. And then we also have the obstetric gynecology clinic, which is run on Tuesdays and on Thursdays. We have the pediatric clinic, which is run on Wednesdays. And then we also have the ENT clinic, where we have the ENT doctor coming in, and that is run on Fridays in the morning. There is also a pediatric surgery clinic, which is also on Fridays.
Our child welfare, we normally do them on Wednesday, Friday, and Saturday from 8 a.m. to 2 p.m. We have our ENT clinic Friday, 8 a.m. to 10 a.m. We normally have nutrition services on Tuesday to Thursday, and we have extended our radiology services from Monday to Friday to Saturday nowadays. Initially, we were running up to Friday, but currently going up to Saturday.
We deliver all our services with utmost diligence, integrity and equality.
We see everyone at the Buruburu branch. We do not discriminate against anyone, either on race, on religious grounds, or disabled people. You are all welcome to receive services at our branch.
Be assured of privacy. We normally keep to our ethics. We are so compassionate to our clients. Integrity is all over. So when you come, we feel you, and that is why you can see nowadays we are running, like every Friday we are having a special clinic. Currently we are running the breast clinic. Next month we are coming up with clear colon screening. So don't forget, we are Christ-centered. When you come, and we don't segregate because you are a Christian or a Muslim or Hindu. We treat every client as equal as any other.
Capuchin TV, kitambulisho Katoliki.
Welcome back to this live health discourse with me, Sasha Elizabeth, and in studio I have Dr. Stephen Thigu, a medical officer at the Mater Misericordia Hospital. We are glad you're still keeping us company, and remember, we bring you this kind of discussions and discourses just to enlighten you more on different ailments, the signs and symptoms, the causes, as well as advise you on best lifestyles, practices to adapt to be able to live a healthy life. As I mentioned in our first session, you can send your questions, your comments, your feedback on our social media platforms, and remember, our number is just 0717 424 866. You can also send an SMS on 21760, or just drop your comment or message on our social media platforms. That's YouTube, Twitter, and Facebook. So we proceed with our discussion, Dr. Thigu. Let's get to understand now the signs and symptoms. What is it that can be indicative on your body? What changes can show that actually you've got an underlying disease, thyroid disease in specifically?
Yeah, thank you for that question, Sasha. As I mentioned, you'll notice that I just talked broadly about thyroid diseases, and those that cause too much of the hormone as hyper, and too little of the hormone as hypo. So because this is such a broad topic, we are confining ourselves to those that cause too little of the hormone or hypothyroidism.
Yeah.
And as I mentioned just before the break, is that we have this subclinical type, or the type that it's not very easy to pick or notice as you're walking around. So what does that mean then, that it's not easy to pick or notice? It means that it can look like many things. It can look like depression. So starting up from the head, we have someone who is slowly losing their hair, and perhaps the reason they're experiencing hair loss is because they have too little of the thyroid hormone. Okay? You may have someone, among children we see mental retardation sometimes, and this may be as a result of hypothyroidism. We have someone having difficulties concentrating, paying attention, and it's persistent. This may be hypo. Depression, depressed mood most of the time, hypothyroidism. You may have people who complain of weight gain that is unexplained. I try hard to diet and to do other things, because we say the thyroid hormone controls metabolism, or tells your body burn this and break this. They are just gaining weight that you can't explain. Again, hypothyroidism. You may have people struggling with sleep. We call it excessive sleeping, hypothyroidism. Constipation, sometimes hypothyroidism. Some swelling in the legs, call that myxedema, again, hypothyroidism. So you'll notice that it looks like many things. The one that we see, obviously, for most times, is a swelling on the neck. When people see a swelling on the neck, they know, okay, that's a goiter. Well, a goiter just means a swelling. It doesn't say whether that swelling is producing too much chemical or producing too little. More often than not, the people with that swelling, they tend to produce too little of the hormone, so they present with hypothyroidism. So you notice that it's affecting everything from up coming down. And as I finish in describing some of the symptoms, one that is not talked about a lot is infertility. People who are trying to conceive and having difficulties with that, you will find that it's an issue with the thyroid deficiency or hypothyroidism. So you'll notice such that it's, you have symptoms running all the way up, coming down, but the underlying thing is that your body is slowed down. I didn't mention the heart issues. Again, people who tend just seem to have, the heart rate is always slow. They have very cold extremities persistently. Most times of the day, they don't seem to be as energetic. Again, it may be because they are experiencing or they have underlying hypothyroidism.
Do all hypothyroidism patients have swollen throat, a swelling on the throat?
That's not the case. So for a normal person, the thyroid gland is not visible. You say that it's just a small 10-20 grams just below the Adam's apple. So it's not something that you can see, okay, for most people. But you find in places where we've had iodine deficiency, lack of that. You remember we talked about iodine at the beginning of this talk?
Yes, I do.
Places where you have iodine deficiency. So this small gland tries to work hard with the little that it has to produce thyroid hormone. In the process of working hard, it grows big, okay? So then you end up with a swelling. So some people may have the swelling, but most people may not even have an overt swelling that you can pick out. And some other thing that I'd like to add there is that some people may have pain, especially the short-term disease, what we call acute thyroiditis. They may have pain, something that you feel when when you go to see the doctor and they examine, they may notice that there is a bit of pain around the gland. Because we said, like any other part of the body, it can be infected. It can get a disease coming in there. So some people may present with some pain. But by and large, you don't necessarily have to have a swelling for you to be having hypothyroidism. Wow. Yes.
Okay. Thank you so much. So now, please allow me to sample some of the feedback. Nora Moore is asking, can the thyroid affect the brain? Can the thyroid affect the brain? Then Nancy Kinyo is asking, is it curable? That's where we are coming to, Nancy. But can the thyroid affect the brain? Speaking of if someone were hypothyroid, what do they complain of? Speaking of the signs and symptoms, can it affect the brain?
Thank you. That's a very good question, because Yes, it can. And to just shed a bit more light on that, when a lady is pregnant, as part of the screening, sometimes we check the thyroid hormone levels. And if we find that the thyroid hormone is low or they have hypothyroidism, we are very aggressive in treating that because we are very keen to ensure that the baby develops normally. So as I mentioned, as one of the symptoms as mental retardation, hypothyroidism, especially affecting the unborn children, we are very aggressive in treating that. So hypothyroidism can interfere with, we call it cognitive function or ability, to think, to process, and sharpness. So it's important for it to be treated, yes.
So how do you diagnose hypothyroidism in a hospital?
Okay, thank you. So the approach we take in diagnosing, someone has to first come to hospital. And remember, I listed a list of many non-specific symptoms. It's not like I have a stomach bug and I have diarrhea and I treat it. Someone may just have these dull symptoms. And most times when you present in a hospital and you have these symptoms, you explain it to your doctor. There's a simple blood test that we do that measures the levels of this hormone in the body. Okay, so it's a quick test. We just get a blood sample, and we can be able to quickly tell how much, how well is your thyroid gland functioning. Now, based on the findings of these tests, these blood tests, we can go further to do additional tests to tell whether do you have this low hormone because of an infection or because of an autoimmune disease, what I said earlier, affecting you, or do you have this because of some deficiencies and so forth. So it's just a simple blood test that can be done routinely in most of the facilities. So that is usually the starting point. Okay, so additional tests to check the thyroid gland, and this will be now tests that are prompted by these initial tests, may include taking a needle and just getting something we call a fine needle aspirate, just drawing something like blood from where the gland is. This is done by a more experienced doctor in that field. We may decide to say, okay, let's give you something that you take in and then we image. We take you to scan it. We may decide to say, let's do an ultrasound just to see what's happening around the gland. So these are additional tests that can be done. But the starting point, most people, is just a blood test. The same way you check your blood sugar, we can check your thyroid hormones in blood when you come to the hospital.
Great, that's quite profound and clear. So now, after making the diagnosis and you find that this patient is actually hyperthyroid, what kind of treatment modalities do you administer to them?
Thank you. And part of the big reason why we are highlighting this disease today is because it's something that can be treated.
That's I think that's response to Nancy Kinyua's question.
Yes, yes, Nancy, this is something that is treated, and it's treated by taking a pill. We replace the hormone with a pill. So the doctor will determine the dosage of that pill. But most times, because you see, I said some people may have too low, others just slightly low, and so forth. There may be an initial period where we give you the drug, we follow you up 1 month, 3 months, then we realize, okay, this is the perfect dosage for you. Just a simple pill that you take in the morning, an inexpensive pill called levothyroxine, readily available. The other day I was just looking through literature and realized that levothyroxine, that drug that we use to treat low thyroid hormones for most people, it's one of the most commonly prescribed drugs in the US. So basically it's telling you that because people there are keen to be checked, and they have identified that there are many people who have very low of that hormone, they correct it. And most people, after you treat, you can generally lead a normal life. You can go ahead with your activities and so forth, and it's just a pill that you pop in the morning. So the dosage of that pill is different for everybody that you're treating. So you titrate this over a period of time during reviews, and then get to a perfect dose, and then agree on when you routinely check the levels of this hormone.
Wow, thank you. Thank you for that, Dr. Thigu. Now, how long does it take for someone to be declared fully healed or free from hypothyroidism?
Thank you for that question. And it's a common question that we get at the hospital, because when you start treatment for people, it'll be like,
they
at what
always
point?
Want to know,
yes.
for how long am I going to take the tablets or the prescriptions?
Yes. When do I stop taking this drug? Do I have to be on this drug forever? I'll tell you, it depends now on the nitty-gritties of the thing that is causing the disease. Okay? So if we are able, if something that can be corrected, like I said, you may just be having an acute infection that is treated, it goes away. We are following you up in the clinic, we come and check, oh, the thyroid hormone levels are high. We reduce the dosage of the drug. We continue reducing until a point you say, no, this person seems to be producing enough of this hormone. Let's stop it. Okay? But I'll tell you that most people, they stay on this prescription for life. But, think about that compared to infertility, mental retardation, and many other things that are effects of hypothyroidism. And I've not even, scratched the ground yet, because I've not talked about heart complications that people may experience because of that. So it's important that you make that decision with the doctor in follow-up. Don't just decide, I'm now cured, let me discontinue my medication. Make that decision based on what you find with your doctor during the visits when your thyroid hormone levels are checked.
Can this condition affect lungs or the respiratory system? Because I know it is a question that someone has asked that question. Can it really affect the lungs specifically?
As I mentioned earlier, majority of the people will have what is called subclinical hypothyroidism that is not disturbing you enough to want to go to hospital, okay? But you may have now the other extreme of people who have complication of severe hypothyroidism, okay? And these complications can go all the way to a coma. And by the time you're getting, a coma means that you have lost your consciousness. By the time you're getting to those levels, even treatment is hard. So, to answer that question, when you talk of respiratory system, you're talking from the nose all the way to the lungs, okay? We say that there are people who may have hypothyroidism with a goiter, a swelling, because the gland is trying to work hard to do what it's supposed to do, but is not achieving that, so it's swelling. As it is swelling, it may compress some parts of the airway. So you may have people who have that swelling, and then they have hoarseness of voice, for example. They may have difficulties with breathing, excessive snoring and so forth. So these are people who you'd say that the mass effects or the bigness of this gland becoming too big as it's trying to work hard is compressing on some vital structures around the neck that interfere with breathing.
With the breathing system.
Yes, that's the way that I think it can affect the respiratory system. The other way is that because your heart, it may cause an excessive slowing of your heart, you may end up with some retention of water in the lungs. So that's another way, but that will be happening at the face of complications or, severe hypothyroidism.
Okay, at a very advanced stage of the medical condition, right? So what are some of the complications of untreated or late diagnosed hypothyroidism?
Okay, so thank you for that. And we have already alluded to some of those. We talked of, things like infertility and mental retardation. But this will happen more when you have subclinical disease. But assuming that the hypothyroidism is so severe, you may get to a state we call a myxedema coma. Because we say that generally when you eat, the thyroid hormone tells the body, now burn these carbohydrates very fast, generate energy so that this person can be active. But now you get to a situation where you're not burning them as fast, and you're ending up with a lot of depositions all over, what we call myxedema. So it may go that way until a point where you're so slow, or things are so slowed down in your body, that you're going to a stage of a coma. By the time people are coming in with that thing that we call myxedema coma, you go straight to ICU. Sometimes it's hard for someone to make a diagnosis of that because there are many things that can cause you to get to that coma. And you'll find that the death rate for people who present with this severe complication is almost 60%. Like the chance that you come out the other side, it's 4 out of 10. So that is the severe end of the disease. But other issues that you may have, it may interfere with the functioning of the heart. So you may experience things that we call arrhythmias, problems with the way the heart beats, and therefore ending up with some, heart illnesses. So you notice that it's hitting out on your major organs. Yes.
Judy here is asking, what does your throat remain swollen? Does your throat remain swollen after treatment? For those who present that sign of swellness on your throat, does it go off after going through the treatment process?
Let me clarify first that the swelling is on the neck.
It's on the neck.
Yes, and on the neck there are many structures that pass there, and we say the thyroid gland is just below the Adam's zip. Okay, so the one that we see a lot is the swelling on the neck. Okay, so part of treatment, if you remember, I just talked of hypothyroidism, where we're reading in your blood and seeing that you have little of the chemical. But assuming that what you're presenting with is the swelling, and the swelling is compressing things around there, we can prepare you medically by a treatment so that you are ready for surgery, because the extreme end of treatment of this significant swelling that is already causing, it's compressing vital things here, like, disturbing with breathing and so forth, is surgery. So the thyroid surgery is one of the most commonly performed surgeries within our facilities locally. And most times you have people who have had thyroid surgery, but you can't pick it because it's just cut along the crease line. So to answer that question, can the swelling go away? Yes, it can go away through surgery. Yes, it can be removed surgically. And because this is such a big gland, you don't have necessarily to remove all the gland. Sometimes you do surgery and leave a bit of that. Sometimes if the whole gland is the one which is sick, you remove it and then you give someone the hormone to be using. But yes, the swelling can be removed surgically. Yes.
Great. So time is against us, and you're in a few seconds. Please, could you please address the viewer and give them your parting shot in as far as thyroid diseases are concerned, and specifically hypothyroidism, which is more prevalent across the globe.
Thank you. So we say that hypothyroidism has a prevalence of all the way up to 10%, 1 in 10 people walking around with hypothyroidism. You say that it tends to affect women more than men. And we say that some of its effects may be things like mental retardation, infertility, affecting your heart rhythms. And you notice these are all serious things that we pick out. So my take-home message is that if for some reason you are there struggling, you've been told you have this depression, it's not going away, sleep disturbances, weight gain that cannot be explained, difficulties concentrating, constipation, if you have these insidious symptoms, infertility, please, when you walk to the facility, you can also have your thyroid hormone levels checked, and it can easily be treated by being given a pill to optimize your thyroid hormone levels. Thank you.
Thank you very much, Dr. Stephen Thigu, for creating time for this important discourse. We really appreciate your time. We really appreciate that you are willing to share and respond to our questions. So we appreciate that and hope that we get to host you again soon to discuss more on this or different other topics in the medical field. All right, it is an important subject that is rarely discussed, but it's also significant that we create time to get to understand more about this. So we do our best to give you important information about different diseases and medical conditions and disorders so that you can equip yourself with the information. Once you discern these signs and symptoms, you know at what point to seek medical attention so that you don't find out when it's too late to control or to cure the disease. So this is the end. We've come to the end of our medical discourse this evening. Until next Friday, when we bring you such with a medical officer and experts from Mater Misericordia Hospital, I'd like to call it a wrap. My camera operator has been Ivan Savannah. On the other side of the gallery, we had our sound mixer, Kevin Kitavinzisa, and our audio mixer has been Edna Mumbi. And as usual, we have Peter Mwangi on our transmission desk. See you next time. Have a great weekend and take care of yourself. My name was Sasha Elizabeth. Goodbye.
Welcome to Mater Misericordia Hospital, Buru Buru Clinic for holistic medical services.
This is Buru Buru Medical Center, which is part of Mater Hospital. And at Buru Buru, we essentially offer services offered in Mater Hospital.
We are located in the first floor failing building above Quick Mat. In Buru Buru, we have general consultation Monday to Friday. Saturday and Sunday they are still available. We still have specialists. On Tuesday and Thursday we have our gynecology clinics running from 8 a.m. to 2 p.m. We have a pediatrician clinic running on Wednesday at 8 a.m. to 2 p.m. We normally have a wellness, which we normally do from Monday to Sunday. Every day, feel welcome, you can come.
Experience the difference in our wide range of quality, responsive and compassionate healthcare services.
We have very highly skilled and qualified staff running the units. We offer services including doctor's consultation services, which is the general doctor in the outpatient unit. We also have laboratory services and pharmacy services. On particular days of the week, we have specialized clinics, which include the physician clinic, where we have our hypertension and diabetes patients followed up. And then we also have the obstetric gynecology clinic, which is run on Tuesdays and on Thursdays. We have the pediatric clinic, which is run on Wednesdays. And then we also have the ENT clinic, where we have the ENT doctor coming in, and that is run on Fridays in the morning. There is also a pediatric surgery clinic, which is also on Fridays.
Our child welfare, we normally do them on Wednesday, Friday, and Saturday from 8 a.m. to 2 p.m. We have our ENT clinic Friday, 8 a.m. to 10 a.m. We normally have nutrition services on Tuesday to Thursday, and we have extended our radiology services from Monday to Friday to Saturday nowadays. Initially, we were running up to Friday, but currently going up to Saturday.
We deliver all our services with utmost diligence, integrity and equality.
We see everyone at the Buru Buru branch. We do not discriminate against anyone, either on race, on religious grounds, or disabled people. You are all welcome to receive services at our branch.
Be assured of privacy. We normally keep to our ethics. We are so compassionate to our clients. Integrity is all over. So when you come, we feel you, and that is why you can see nowadays we are running, like every Friday we are having a special clinic. Currently we are running the breast clinic. Next month we are coming up with clear colon screening. So don't forget we are Christ-centered. When you come, and we don't segregate because you are a Christian or a Muslim or Hindu. We treat every client as equal as any other.
Capuchin TV, kitambulisho Katoliki.